Hello everyone. Today I will be discussing prostate cancer for my public service announcement. My name is Max Elder. Prostate cancer is a disease that affects many men worldwide. Although it is one of the most commonly diagnosed cancers among men in the United States, it is also one of the most treatable when detected early. However, many men are still uncertain about the role of the prostate and how prostate cancer develops, and when screening should begin. So my goal today is to provide clear and practical information that supports awareness and informs decision making so you can make better decisions for your health. Uh, for our agenda today, we'll be going over an introduction, genetic and environmental factors, prostate cancer development and progression, screening, diagnosis, and treatment, trends and survival outcomes, prevention and public health steps, and then we'll end with a conclusion, references that I use to make this awareness for you today. So what is prostate cancer? Well, if you look at the image below, it shows how the prostate is a small gland located below the bladder and surrounds the urethra. Uh, its main function is producing fluid that helps form semen, and prostate cancer begins when the cells in this gland grow and divide in an uncontrolled way. Some prostate cancers grow very slowly and may never cause symptoms, while others may be aggressive and spread quickly. And changes in the prostate size are common with age, as well as how this develops is from mutated cells that grow abnormally and form a tumor. Now, an enlarged prostate doesn't necessarily mean there is cancer, as there could also be benign prostate. Prostate cancer is diagnosed in hundreds of thousands of men every year. And, however, its death rate and survival rates have changed over the time period, as better awareness and early detection has led to higher survival ratings and less deaths. Not all groups experience prostate cancer the same way. For example, Black men have a higher risk of developing prostate cancer and are more likely to be diagnosed at a later stage. Also, some things to keep in mind are age, family history, and environmental and social factors also influence risk. So what to know about prostate cancer? Well, a couple things to know are prostate cancer cases have risen 3% per year and is the second most cause of deaths from cancer in men. Often there are no symptoms in the early stages and it can go unnoticed before it starts to cause problems. When detected before it spreads, the survival ratings are a lot higher and if treated early. And as in the infographic, as you can see, 99% of prostate cancer is treatable if detected early. Also, prostate cancer is the most common aside from as a non-skin cancer in men. So moving on, we're going to talk about genetic, environmental risk and factors. So several factors influence a person's risk of developing prostate cancer. The first is age plays the major role. The likelihood of developing prostate cancer increases significantly after the age of 50, and most cases over 65 as well. Family history is another important aspect. If someone in your family has been diagnosed with prostate cancer, it increases your risk times 2. Another important factor is genetics. So if someone in your family has a mutated BRCA1 or BRCA2 genes, this will also increase your risk for prostate cancer. Now, these would be inherited from your parents, and basically they increase your risk for prostate cancer. And this is something that you can also look for when talking to a doctor and getting screened for prostate cancer. These genes specifically are used to help repair damaged DNA. So when they are mutated, it means that your cells are more prone to develop errors and can lead to prostate cancer or potentially other cancers as well. Another important factor is race. In the United States, African American men have higher rates of developing prostate cancer than others, and also may have more aggressive forms of prostate cancer. This may be related to genetics and systematic healthcare disparities and differences in screening access. Another aspect is lifestyle choices can increase your risk, such as diets high in processed or red meat and saturated fats have been linked to higher prostate cancer risk, while diets with more vegetables and fruits and whole grains are linked to better health outcomes. Regular physical activity also helps in maintaining a healthy weight and will be beneficial in reducing your chance for prostate cancer. Environmental exposures is another aspect that should be looked into as well. There isn't as many hard links to factors that can cause prostate cancer, but some would be arsenic exposure has been shown to have an increased risk in prostate cancer. So how the prostate cancer develops, this starts with understanding what normal cells are supposed to do. So in a healthy body, cells grow, divide, and die in a regulated cell cycle. And what happens is in the DNA of the cells, there can be mutations that lead to cancerous cells forming. And cancer occurs when this control of the cell cycle breaks down and causes the cells to continue to divide even when they should not. Over time, this abnormal cell that has a mutated DNA can cause a tumor to form, especially when they're rapidly developing in a centralized location. So think of it this way, there's a cell that has been mutated and most likely should have died and gone away. And instead what happened is it starts to replicate itself and divide a lot quicker. And as that happens, it ends up becoming a much more bigger tumor inside your body. So when that happens, it becomes dangerous and it can start to spread to other areas around the initial area that it started, into like other tissues or organs that are nearby. So for instance, in prostate cancer, it could move to the rectum or the bladder, and in more advanced stages, it can get metastasis, which would then lead it to move into other areas of the body, such as through the bloodstream, and can lead to other cancer types, as well as also the bones. So moving on, prostate cancer progression. So if you look at the image, it shows a couple of different stages of prostate cancer, as there's a T1 and T4. T just stands for tumor. So for the first stage, it's a lot smaller. As you can see in the prostate, it's not too big, which means that it's not very noticeable or detectable, and you wouldn't really notice any symptoms at first. At this point, this is where having a PSA screening, you may be able to find out that there is something there that should be treated. In the next stage, it gets a little bigger and it's still contained within the prostate, but it may be more detectable through other methods such as the digital rectal exam. And in the third stage, it has grown beyond the prostate and is starting to move into other tissues around the prostate. And the last stage is the most advanced stage, where it's fully moved into other tissues around the pelvic area. So this progression shows why early detection is important, because the earlier you find it, the more centralized the prostate cancer tumor is, which means that there's more ways to deal with it and maybe take it out before it becomes worse and an aggressive stage. Because once it moves away from the prostate into other areas, then it becomes a lot more complex and can make it more difficult to eliminate or subside. As age increases, the likelihood of cancer development because of our cells accumulate DNA damage over time, and the longer those cells divide with that damage, the more chance there is for a mutation to lead to cancer. So for PSA screening, what this is basically the prostate-specific antigen test, which what they do is they, using your blood test, they're able to measure for PSA levels, which is normally produced by the prostate, but higher levels of this PSA in your blood can indicate inflammation of or enlargement or potentially cancer, which is what they're looking for. So doctors use this test and also with a digital rectal exam to assess the shape and size of the prostate cancer. However, these tests are not always straightforward and can be at times confusing because other factors that can make the levels of PSA seem as if there's an issue when there is not, such as having an increased PSA level because of urinary infections, prostate inflammation, recent ejaculation, strenuous exercise like cycling or running, from just age and other medications can cause this PSA level to rise. And obviously, as the higher the PSA level, the more likelihood that there is possibly cancer. So usually it's not a one and done type of test. This is usually something that's recommended to, if there is a noticeable increase in PSA levels, to potentially do another one to make sure that it is not a one-time event from some other factor, but instead maybe a consistent trend. So the goal of that is to try to detect the cancer early and avoid unnecessary treatments for cancers that pose little risk. So if a PSA level remains high or a lump is found during a physical exam, a biopsy can be performed to check for cancer cells. So for the diagnosis and treatment pathways, first would be doing the prostate-specific antigen test, and then including the digital rectal exam to basically get two sources of information for determining if there's a cancer and what is the stage of that cancer. Moving from those, the next thing would be biopsy, which they take a small sample from the prostate to look at it and see if there is any cancerous cells in the prostate. Now, once they have confirmed that there is cancer in the prostate, the treatment options are quite extensive, depending on the stage, aggressiveness, and what you would want it to do for your own preference. So there is active surveillance. If the prostate cancer is slow and seems not invasive, you may just be a watch and wait kind of scenario to see if anything gets worse and if there's something more you can do later. Another option would be is to perform surgery to remove the tumor completely out. This is mostly done when it's localized and not moved into tissue nearby. Next, there's radiation therapy, which targets the cancer cells. Overall, this would be more extensive as there's other side effects that come into using radiation therapy. But using that, it can help to destroy cancer cells and potentially slow the growth of the cancer. Also, there's hormone therapy, which reduces testosterone levels, since many prostate cancer cells rely on testosterone to grow. And lastly, chemotherapy for advanced disease and cancer. So treatment is increasingly becoming more personalized, meaning doctors are able to tailor therapies to your specific conditions and preferences. So for trends in prostate cancer over time, you can see that there was quite an increase during the 1990s, which is actually when the PSA was introduced and had become a common thing to do in screening for prostate cancer. After this happened, the rates started to decline and stabilize, which is a reflection of the benefits of screening and the need for careful selection in your options of treatments. So survival rates have significantly changed as well, depending on your age. So for your age, your survival rates under the age of 60 have very high survival rates. However, in men over 70, especially if the cancer is discovered late, the survival rates start to decrease. And this also shows the value of early detection of the cancer before it spreads. As the later in the stages, the more complex the treatments are for dealing with prostate cancer. So what can you do to prevent prostate cancer and things to know for your own public health? So even though age and genetics cannot be changed, there are things you can do, such as eating balanced, rich diets in vegetables, fruits, and whole grains, maintaining a healthy weight and exercising regularly, reducing alcohol and tobacco products, is especially avoiding them would be the most helpful in preventing, as both alcohol and tobacco have known carcinogens that lead to damaging your DNA in the cells, and eventually over time, as you continue to consistently do that, it can lead to cells becoming cancerous and creating cancer in the body. Also, if you don't know your family history, it is good to know if you are in that bracket that would be considered a higher increase for chance for prostate cancer. Since if your family, such as your parents, have any mutated genes such as BRCA1 and BRCA2, then you are automatically at a higher risk for prostate cancer. And knowing this early can help you to prepare to take measures in your own hands early before things can get worse. If you already know that you have a high chance of getting prostate cancer, you can screen for it earlier to potentially treat it before it gets worse. So in conclusion, prostate cancer is common, but it is very treatable when detected early. The problem is it's not noticeable unless you look for it. And even with the options for screening, it's not always conclusive. So starting early and talking to a doctor will help in the long run, especially knowing that it is very common. It's not something that you could say you would just never get. It's probably better to look early and not have to worry about it in the longer term future. And understanding your personal risk factors and recognizing this value of early detection and changing lifestyle approaches to help prevent potential cancer outcomes in the future, all of these things combined matter, because many of us know someone who has probably been affected by cancer, and sharing this knowledge with others can help protect others and the people that we care about. All right, well, thank you. My name was Max, and this was my public service announcement for prostate cancer.